These are some of the topics we will be covering today for some basic breast cancer facts, including, first, recognizing what breast cancer is and is not. Second, you will learn the importance of early detection and the treatment for breast cancer. Third, you will learn what you can do to help yourself, your family members, and friends to live and not die from breast cancer. And fourth, you will learn how Chicago Hearing Society can help you. Statistics related to breast cancer. It is estimated that about 264,000 women will be diagnosed with breast cancer each year. And of those diagnosed, about 42,000 women will die from it. The disease occurs almost entirely in women, although men can get it too. Research shows that the chances of a woman developing invasive breast cancer at some time in her life is about 1 out of 8. What is cancer? Cancer results when a group of cells grows and multiplies in a disorderly and uncontrolled way. In order to understand breast cancer, it's helpful to have some basic knowledge of the structure of the breast. The main structure inside the breast that makes up milk is called lobules, which are milk-producing glands. Breast cancer is a malignant, which means cancerous, tumor that develops in the breast that line the ducts, or in the cells that line the lobules of the breasts. Breast cancer spreads throughout the lymphatic system and in the blood vessels. Signs and symptoms. Some symptoms are visible and some are not. A new lump in the breast or underarm, in the armpit, irritation or dimpling of the breast skin, a change in color or texture, a pulling in of the nipple or pain in the nipple area, or a discharge other than breast milk, including blood. It is important to recognize what is normal and what is not normal. And if you notice any change, it's important to tell a medical doctor right away. We don't know what causes breast cancer. However, there are a few things that researchers understand that could put you at an increased risk. The main factors is being a woman and being over 50 years of age. Other risk factors you can't control include a family history of breast cancer, a personal history of breast cancer, because if you have had it, it's possible it will reoccur. Risk factors you can control: being overweight, not exercising regularly, smoking, which you should decrease, alcohol consumption, which you should increase, and taking hormones. There are 3 ways in which women most often find out they have breast cancer: mammography, clinical breast exam done by a physician, and breast self-exam. Out of these 3, mammography is the best at identifying breast cancer. Mammogram results can be either normal or abnormal, which means not necessarily breast cancer, but that you require follow-up tests. Breast cancer can be treated in multiple ways. First, by surgery, which could be a lumpectomy, which is the removal of the lump with a margin of tissue, or a mastectomy, which is the removal of the entire breast, or a node dissection, which is a removal of lymph glands in the armpit. Secondly, chemotherapy, which utilizes drugs to destroy the cancer cells. Third is hormonal therapy. And the 4th way is radiation therapy.